support of the Excise and Excise-Equivalent Duties Table Tobacco Products Amendment Bill. And at the outset, I need to put on record that, like my colleague, Dr. Jackie Blue, I'm also a former smoker, and that I gave up pretty much cold turkey about 12 years ago. And I didn't use nicotine supplements. The mindset change and the realisation that I came to was that when you give up smoking, you're not losing something, you're gaining a heck of a lot. And it was only when that mindset change came that I was able to sustain that very painful 72-hour period that nicotine addicts go through when they're withdrawing from it. But after that, actually, it does get easier and easier, and I hope that those who are still addicted to nicotine and who are motivated by the changes in this bill will come to that realisation as well. But I do understand how hard it is, and I'm mindful of the comedian who once said giving up cigarettes is really easy. I should know, I've done it about 25 times. And I'm sure the House is grateful to my medical colleagues, Dr. Blue and Dr. Paul Hutchison, and in particular Paul, for his graphic depiction of his time as a pathology registrar and the debilitating effects of smoking. But he also made a very good point that the medical fraternity was, well, perhaps slow to pick up and develop an evidence base for the negative effects of smoking. And there are even print ads from the early 20th century of doctors endorsing certain brands of cigarettes. I was smoking when I started work at a bank in Dunedin North, and as a teller I remember it now with some horror, but it was the norm then, of course, that I would be serving customers during the day with an ashtray on the counter and a cigarette burning on the counter. Such was the acceptance that we had of smoking as part of what we do. And yes, the opposition can and have gently and lightly ribbed the government when it was in opposition for opposing certain things. But I do think we as a society have gone on a path of enlightenment. So I would like to suggest that that's what's happening here. I was also in the UK at the end of 1988 when workplaces went smoke-free there, and I well recall a colleague of mine heavily addicted to nicotine who smoked about 40 a day, who was so distraught by that she felt she would need to resign because she couldn't survive the day if it wasn't for the cigarette on the desk. But she got through that as well, and I think that we do need to support those people who are addicted. The suggestion that this is some kind of tax for revenue-raising purposes and even worse, to subsidise tax cuts, I find very, very hard, and I'm sure Mr. Galloway had tongue-in-cheek when he said that. Thank you. And I also think that what the Honourable Ruth Dyson said in talking about being careful about where the money goes and the public health initiatives that might be needed to support this is relevant, but what we need to remember, as other members have said, is that about $1 billion, maybe $1.1 billion of revenue is collected through tobacco excise, but the total costs on society of smoking, and in particular that fall on our health sector, comfortably exceeds 1.7 and is approaching $2 billion. So it's really not accurate to say that somehow this is going to be a great windfall to the government. And I also expect that the quitline service, which is not subject to fiscal constraints as I understand it, will be flooded, basically. Well, there's no cap on the number of people who can go to quitline and get the subsidised support that is available, and I've got no doubt that there'll be a huge increase in demand for their services, and I certainly hope that's the case. But I want to focus on the case for using tobacco excise tax as an effective means for reducing the prevalence of tobacco smoking in New Zealand. Now, we've talked about the positive effects on that. It's known in economics as demand elasticity, and the best research suggests that the price elasticity of tobacco is probably about negative 4.8 or 5, which means that on average a 10% increase in the price would be followed by a decrease in consumption of about 5%. But of course that doesn't tell the full story, and you do need to drill more deeply into the research in this area, because for adults who are addicted to nicotine, the price elasticity is slightly less than that. There is definitely evidence that it will reduce prevalence in that group. But I think what's really relevant to this, if you look at the evidence of young smokers or young people considering smoking, the evidence is extremely strong that the price elasticity in that group is much higher. It ranges from about minus 0.9 to 1.5. In plain English, that means young people are 3 times more likely than older people to stop smoking or to not start with this level of excise being increased. So they're far more price sensitive. And it's for that reason, among all of the many good reasons for supporting this bill, that I do. Now, it's also important to make sure that when we look back into history, these increases in excise tax actually have had a positive impact. And it is very important to note that we see a step change down, which is absolutely positively correlated with the increases. It started with the smoke-free workplaces in 1990, then there was an increase in the excise in the late 1990s, and again in the early 2000s. And all of those impacts are very, very highly correlated and, in my view, causative of the reduction in smoking. Now, another way to drill into the prevalence data is through ethnicity. And this is a really concerning issue that Minister Turia and others have talked about, but particularly Maori women who are smoking at the rate of nearly 50% of the population. Pacifica are higher, but not quite at that level. What's interesting is the Asian statistics where Asian men smoke at about the national average. But there's a dramatic reduction for women. Asian women only smoke at the rate of about 5.2% of their population. And I'm not quite sure what the cultural differences are, but it could be an excellent body of research to drill into what those reasons are, which means that they smoke at a much lower rate than we do. So, in summary, Mr. Speaker, I think this is an outstanding initiative. I think we'll hear the inevitable retorts from the tobacco industry about why this won't be a good idea. I'm encouraged that almost entirely this House will support this bill and ignore that rhetoric, because this will have nothing but good things for our society and for our health system. And for that reason, I very strongly support the bill.
That concludes the debate.